This is a part 2 series on hair loss during the COVID era, and a recent study was performed in 2 Spanish hospitals looking at whether male pattern baldness actually could be linked to COVID. Now, I want to put a disclaimer that this study is only really just a survey of 2 hospitals, so it definitely has very, very little total accuracy that we can hold our hats to. But I think it's interesting because the prevalence of those with severe cases of SARS-CoV type 2, or in other words, COVID-19, has really been much higher in males than females for some reason. Obviously lower in very young individuals, especially prepubescent children, but higher severity in men. And so the thought process is whether there is a higher androgen component to this. And the 2 Spanish hospitals, they looked at the prevalence of androgenic alopecia in men who were admitted for severe cases of it, and they found that there was about a 71% incidence of it, with about half of those cases being severe male pattern baldness, about 39%. And there were no age-matched incidences of hair loss, but in the Spanish population in general, the Caucasian population is about 31 to 53%. So obviously this study is lacking a lot of data, but it's interesting that there may be a thought process that somehow androgens could be involved, and the authors concluded that treatment of these patients with potentially anti-androgen therapy, such as finasteride, dutasteride, spironolactone, enzalutamide, and possibly cannabidiol, might have reduced the severity of the COVID illness. I don't want everyone just to start finasteride or Propecia simply for this, but it was interesting. Also, there's maybe a thought process of why hydroxychloroquine could have showed some early success, since chloroquine phosphate, the sister drug, actually does help reduce testosterone levels in rats. So, of course, all of these things are incredibly preliminary in the thought process. I just thought it was more interesting to share with the audience rather than conclusive in nature, and take it for what you will, but it may be something that could be interesting in terms of future hair loss issues. And one more thing is that the Gabrun sign, or GABRN sign, is a comment of whether there is actually androgenic alopecia present in the majority of these patients that actually have this type of hair loss, that are presenting with a issue with COVID, severe COVID symptoms.